Hi, I'm Ross Timms, Manager of the Workplace Health and Safety Department for the QHA. I wanted to talk to you today about workplace health and safety compliance. Workplace health and safety laws are a fairly complex beast, so what I want to do is break it down for you into something clear and manageable so you can understand what you need to do to meet your compliance obligations. The aim of all this is twofold. You want to A, make your workplace safe, and B, meet your legal obligations. Under workplace health and safety legislation in Queensland, you, as an employer, or as it's called in the legislation, a person who conducts a business or undertaking, has a primary duty of care to ensure the health and safety of workers engaged by your business. This isn't a new concept, and you would have heard of that before. But in a nutshell, your aim should be to provide a workplace a number of things. That minimal risk to the health and safety of your staff. You've got to minimise that risk to the health and safety of your staff. You've got to maintain safe systems of work. You need to have safe mechanical plant and equipment. You need to be making sure that your staff use equipment and chemicals safely, and you've got to provide an adequate set of facilities, safe facilities and healthy facilities for your workers, not unhygienic, and also some training and instruction for your workers in health and safety. It's important that someone in your business has carriage of workplace health and safety. If you remember, there isn't a legal requirement to have a workplace health and safety officer or WH&S anymore. So as a result of that, in some cases, workplace health and safety has fallen by the board. Workplace health and safety isn't rocket science. It's been around long enough for you to have at least a passing knowledge of what could be hazardous and how you deal with it. When I go out to hotels, more often than not, there are a few health and safety issues back of house that need attending to, but importantly, what's missing quite often is a systematic approach to health and safety, like ensuring processes and procedures are up to scratch. Let's just have a look at workplace health and safety compliance at a glance. What do we need to have in place to be compliant? Well, here's some of the basics. Endeavour to implement a workplace health and safety management system in your business. This is a layered structure that generally encompasses a series of things, and this is what Workplace Health and Safety Queensland wants you to have in place. Certainly policies and procedures that reflect your commitment in achieving workplace health and safety goals, like having an actual workplace health and safety policy in place. You need a system that identifies workplace risks and implements control measures, and that means things like you need to routinely inspect or audit your workplace for hazards and risks. Have a formal place and process to do this. Like use a checklist on a regular basis, say every 3 months, to ensure or to check for hazards and risks. And in regard to identifying hazards and risks, what you should then do is develop control measures to eliminate or reduce any of those hazards. And that in itself is not that hard to do. In one way you can do it, and these are things that you actually really need in your business, and that's safe work procedures for tasks that involve that pose any health and safety risk to your staff. A safe work procedure is in effect a written method of carrying out a task in a safe manner, like moving bear kegs or using hazardous chemicals. Next, you need a workplace health and safety induction for your new staff and some degree of ongoing training. I guess with new staff, they're obviously new to the workplace and in many cases new to the industry. And in terms of our industry, young casual staff are our most at-risk employees, and it's important they're given appropriate instruction and leadership right from the start so they don't get themselves into any difficulties. You also need a reporting system for workplace health and safety issues, whether that's via an incident report or through the manager's diary, etc. Staff need an avenue to be able to report issues. There also needs to be a consultation process that involves staff and health and safety decision making. Or for instance, you need to canvass them if you can during staff meetings, as an example, for workplace health and safety issues that they may want to bring up, or some solutions that they may have to any problems. You also that's a good avenue or a good forum to advise them of any health and safety outcomes for reported issues. You as a business need to keep up to date with workplace health and safety changes, trends and information. You can do that through the Workplace Health and Safety Queensland website. I mean, you get some of that sort of information through QHA publications, the review or the update. There are always workplace health and safety articles being written. And certainly when you have at management level, workplace health and safety needs to be discussed. And ensure you know what the requirement is to report serious workplace health and safety issues to Workplace Health and Safety Queensland if you have a serious incident at your workplace, and have a copy or access to one of their incident notification forms. Just a quick snapshot of some other responsibilities in terms of health and safety. You're obliged to ensure that an adequate number of your workers are first aid trained, and you've also got to have a number of serviceable, or a reasonable number of serviceable first aid kits at your workplace. You're required to have an emergency plan for your business, and obviously in terms of fire and the like. You need to develop a register of hazardous chemicals for your workplace, and every hotel uses hazardous chemicals, especially in relation to cleaning. And you need copies of safety data sheets for each of the chemicals that you use. You need to inspect, test and tag portable electrical equipment in your business on a 12-monthly basis. We're in the service industry, that's the standard, unless all your electrical circuits are protected by safety switches. Certainly for the older buildings, ensure that any asbestos at your workplace is identified. You need an asbestos register if your premises were built prior to 30th of December 2003. And if you do have asbestos, you need to develop an asbestos management plan. And that's usually done by involving asbestos consultants is the best way to do it. So these are just a snapshot of some of your workplace health and safety obligations. For more information on this and some solutions to workplace health and safety issues, you'll find also on this website a QHA Safe Work Manual. It covers many of the things that you need to know, and including there are templates and forms in terms of workplace health and safety in the hospitality industry. And lastly, please feel free to contact me if you need any further advice. Thank you.